Welcome to another edition of our Facebook Focus. My name is Hasneen Kermali. I'm the Chief Medical Officer here at St. Mary's Hospital in Waterbury, Connecticut. Each month we like to bring you a little bit of a insight to our clinical departments we have here and the expertise that we're able to offer to the community here in Waterbury, Connecticut through St. Mary's Hospital. And so this month we wanted to do something a little bit special. We wanted to focus on safety and quality in our system, and sort of discuss a little bit more about how St. Mary's is doing, what our opportunities are, and where are we moving forward in this very, very important realm, particularly when it comes to providing care for our patients in the community. And so what we decided to do was bring in our guest today, Director of St. Mary's Quality, Safety, and Performance Improvement Office, Stephanie Nelson. Welcome.
Thank you. Thank you for having me.
And thank you for taking a little bit of time out of your day to sit down with me, because I know you're a busy gal here. So before we dive in, tell us a little bit more about yourself, your journey on the road to get to our director position here at St. Mary's.
Absolutely. So the first 20 years of my nursing career was spent at the bedside, which I loved. I spent time in the operating room, the recovery room, and a large portion of my career in the critical care settings.
Okay.
I love patient care, direct patient care. However, as my life and career transitioned somewhat, I found myself moved to the quality department. I first started out as a performance improvement nurse specialist, really focused on refining processes to enhance patient safety overall, and most recently transitioned into the director position and oversee the entire quality team.
And that's amazing, because you come from this perspective on how care needs to be delivered at the bedside.
Correct.
So you've been there, you know best practices at the bedside, and now you're working on processes for the entire hospital, which is a great journey.
Absolutely.
So tell us about some of the more detailed pieces in the healthcare realm. Most people don't recognize we've got an entire department that works on safety, quality, and performance improvement. Give us a little bit about the department and what it does.
Absolutely. So I'm very fortunate to work with a fabulous team. Our team is vital for patients and colleagues and for our community and hospital overall. Quality really is paramount. Patients trust the hospital and clinicians to provide them with the best care possible, and lapses in quality care, as you could imagine, can have serious consequences. And our team is responsible for ensuring that all aspects of patient care are met or even exceed the standards. This can include things like identifying opportunities for improvement and making changes to workflows, applying strategies to enhance safe care, such as staying with our patients who are at risk for falls and staying within arm's reach of them.
Yeah.
This can include things like ensuring the hospital is in compliance with regulatory and accreditation standards, developing policies to promote standardization in some of the situations that we manage daily. And we work very closely with other department leaders to really make sure that those policies, procedures, protocols, and best practices are followed, and that when issues arise, we do promptly address them.
So again, we're focused on the patient,
Putting
the patient in the middle of what we do, making sure they're safe and that they get high quality care from a variety of perspectives. And that seems to be intuitively what we should be doing. So how are we doing here at St. Mary's?
Well, we're actually doing very well at St. Mary's. We have a lot of areas that we focus on in quality, and just to kind of give you an overview, we have a team that focuses on things that we call core measures. So core measures, they're national standards, and they're based on research to reduce complications and improve our patient outcomes. And we have members of the quality team that make certain our patients that present with conditions like sepsis, which is an infection, or a stroke, or our maternal or psychiatric populations are really cared for in a safe, timely, effective manner. We have 2 dedicated infection prevention nurses that monitor all our hospitalized patients that have catheters or special central IVs to make sure that those lines are in appropriately, for one, that they're removed as soon as possible, and that we're following best practice to prevent any hospital-acquired infections. And we do very well with this. We have a very dedicated team that looks at this very, very closely. Those same 2 nurses also monitor all of our surgical patients. So really following those surgical patients through to make sure, again, that we're following best practices, protocols that we have in place to prevent post-op infections, such as proper antibiotic usage, proper skin prepping, and things like that.
And this is where I love the idea that we're working as a team. And there's a lot of collaboration that goes on between our quality team and our frontline patient-facing team. I know a lot of our conversations throughout the day include actually conversations back and forth between the infection prevention team and, say, the ICU team that's taking care of the patient. So they're going back and forth with the doctors, going back and forth with the nurses all day long. It's almost like a secondary look to make sure that the patient is well cared for within the halls of our hospital.
Yeah, and there's times when we might find an opportunity where we can do something a little differently or a little better. And those opportunities are positives to us. We don't look at them in a negative manner because we're always looking to enhance and improve everything that we do for our patients. So, it's amazing when the team comes together and really analyzes those opportunities and can implement some change based on those.
And that's I think the most important part of this. Yeah. We're not saying we're perfect.
Right.
We're saying we're on a journey to continually improve.
Correct.
And I think that's the lifelong journey of medicine. I know, at least for physicians and for nursing and a lot of people in healthcare, it's this lifelong path. It's not that we've gotten to where we are and we're satisfied. We want to continue to push the envelope on how can we continue to do better.
Exactly.
Bring down those infections,
Yeah.
improve how we manage patients with different diagnosis, stroke, heart attacks, infections like we talked about. And that's really the goal that we're trying to accomplish here.
Absolutely.
So where are some of our opportunities for, let's say, doing things better, so to speak? Or how have we been doing to get to that optimum?
Yeah, so we have, obviously, like all hospitals, have regulatory bodies that we're required to report particular data elements to. So some of that is a manual report. Some of it is from some of our registries that we use, let's say for cardiac surgery or our cardiac patients that have catheterizations. Some of it's from the Center for Disease Control, like we talked about infections. So all of these data elements get submitted to these regulatory bodies, like the Joint Commission. I'm sure people have heard of that, Medicare. And we're basically scored and ranked on all of these data elements, and they can benchmark us against the state and national. So we can really see where we fall within the state and national hospitals.
Yeah.
And when you kind of break it down, we really perform very well. We have a long way to go. I mean, we can always improve and always do better, but we've seen a great reduction in some of those hospital-acquired conditions, some of those, they call them harm events, patient safety events, and we've seen a great increase in some of the other metrics that really give us that sense that we're doing better and we're improving.
And I think this is where what I hear on a day-to-day basis when we walk the halls, it's not simply the departments and the patients, it's the whole culture.
Correct.
Here at St. Mary's Hospital, it's a culture of being open. That if there's an issue that's coming up, we're not gonna hide it in the corner. Yeah. We're gonna bubble it up to the surface. Let's understand what the issue is, and let's take care of it and get it to that right level.
Yeah, very transparent, and I think something that is very important to me is that we have the engagement from our frontline team of nurses and colleagues all the way up to our executive team. So it's an all hands on deck. It's not your problem or my problem, it's our problem, and we address it together, and that's, I think, the beauty of St. Mary's.
So what about the patient? Do they feel, or how do they feel we're doing from a quality perspective? Do they appreciate these changes? If I was a patient, I've got an IV line. What's the difference between an IV line here and an IV line centrally? Or if I have a catheter, how is that being managed? Normally, I don't know these pieces. So how does the patient relate, or gather some of this information?
So I look at that as, the patient experience, right?
Okay.
So the patient experience really encompasses all the interactions from the time they walk in our doors till the time they leave. And that can include you communicating to me as my doctor, my nurse being responsive to me, really just how I perceived my health care from the time I walked in the door till the time that I left. And patient experience, in addition to things like safe, timely, quality care, are essential to the big picture of healthcare quality. It's a very, very important area. We keep it front and center at St. Mary's Hospital. We work very hard to round on our patients, which means we go to the bedside, we talk to them, we want to know how their stay is, we want to know how our team is treating them, we want to know how they perceive their experience. And then, we take that feedback, we listen to them, we hear them out, and we can bring that information back to that department leader if there's any areas where we can improve. And we've seen really good results from that when we're rounding with our patients. They give us very good feedback that they do understand their plan of care, they understand the medications that they're receiving, they understand what the next steps are in their treatment plan. So we've seen very good response from our patients overall.
And this is where I'm amazed at this program we've put into place, particularly that leadership rounding, where we're actually going outside of our normal departments and we're cross culture evaluations. So case management or quality will go in and talk to patients in the emergency room.
Yeah.
Outside of their normal sort of day-to-day, and talk to the patients just to see how is everything going, almost like a innocent bystander just trying to understand the situation, and then getting that feedback and incorporating that feedback, understanding that the patient is heard and continuing to improve that model. But there's another level that we also incorporate called the PFAC committee, the Patient Family Committee. So tell us a little bit about that committee and how we engage patients and their families in decisions that get made here at the hospital.
Absolutely. So we do have a PFAC committee that stands for the Patient and Family Advisory Council, and we're actually always looking to grow that and build it. And this group contains actual patients, past patients, current patients. It could be family members of past patients. And this team, they're pivotal when we are trying to make decisions in the hospital that can affect the patient experience. We look to them to be a part of, solutions. We look to them for their input and suggestions. We really want to hear their feedback because our goal at all times is to keep the patient at the center of everything that we do. So having this team provide their feedback to us is imperative. We bring certain initiatives before the PFAC, before we implement them, and we present them and say, here's what we're looking to do. What do you think from the patient perspective? And it's valuable.
And they give us some very direct feedback at times on how we're doing, and we discuss some things. But I love that we're incorporating the patient's perspective in what care they get right here at the hospital too. Again, making sure, and I think a common theme continues to be keeping the patient at the center of what we do.
Exactly.
Understanding that's what we need to do. So sounds like we're doing great.
Yeah.
But I know that we've got opportunities to continue to improve. Who helps keep us on track? Who helps say, lets us know, hey, this area, there's a little bit more improvement that needs to be made, or this area that maybe it's time to focus in on that? Yeah.
So the team in the quality department, we're constantly analyzing data. We're constantly trending data. We're looking for, like I said, overall trends where we can say, hey, we've seen this month over month over month, and I think we can do something to impact this and kind of turn the direction a little bit. So my team is very involved in that. Like I mentioned before, we have regulatory bodies that we're required to report to, like the Joint Commission and Medicare, and even some of the insurance companies that pull different data points from all those platforms I mentioned earlier, like the CDC and the registries and so forth. And they rank us. But why does it matter? Because we really want outcomes for our patients to be the best they can be. We don't want to be the worst at something, so we really aim to drive improvement in any area where we're not quite meeting the target. All of the data points that we submit to all of these agencies, they're all tied to the hospital getting paid, essentially. You know, it's no longer quantity that pays bills, it's the quality of the care that we're providing to our patients, which again, we want good outcomes, we want to provide our patients with the highest quality care possible. You know, and all of this data that we present to Joint Commission or Medicare, it's all publicly reported. So the community and our patients can look at it at any time and see where we measure up in what different categories and how we're doing. And they have a choice. They have a choice in what hospital they want to go to, and we want them to choose St. Mary's. So we're constantly trying to drive and push, you know, the continuous improvement. We actually voluntarily report to an agency called Leapfrog as well. Maybe you've heard of them.
Tell us a little bit more about Leapfrog. We've been announcing Leapfrog and how St. Mary's has been doing something I think we're very proud of. I'm definitely proud of St. Mary's for how we've been doing on Leapfrog.
Absolutely.
But a focus, and tell us a little bit more about Leapfrog so we can...
What's cool about Leapfrog is it's voluntary, right? You don't have to report.
Right.
But we choose to.
We choose to.
So similarly, Leapfrog pulls data. We manually submit some of it to them, and I'll use hand hygiene as an example. We have strict hand hygiene requirements in the hospital, and we're constantly monitoring and observing. So we manually submit some information.
And I want to focus in on hand hygiene for a second. The most important breakthrough in safety forever in medicine was the realization that to wash our hands is good for patients.
Yeah.
I mean, I think that was a breakthrough back in the day. Today it's almost taken for granted that we do this, but we actually watch and monitor how many times our teams wash hands when they go into a patient's room and leave a patient's room. And that's amazing. Like there's a counter that we're making sure that we're hitting and observing. And I remember there's feedback that comes back to everyone who walks in and out of a patient's room. Hey, there's the opportunity to wash your hands before you go in.
Yeah, and we have that culture of safety here. So if I see you going into my patient's room, Doc, and you forgot to wash your hands, I'm going to say, hey, Dr. Kermali, let's foam in, foam out.
Yeah.
So we have that culture here where we can cross-check each other and hold each other accountable, which is amazing. But back to Leapfrog. So like I was saying, we manually submit information to them. They pull some of the data elements from different platforms, and they don't just give us like a number score. They give us like a letter grade. So like back in school, you get an A for exceptional performance, you get a B for like pretty good, C for average, and so on. We've been able to sustain an A for the last 3 Leapfrog surveys, which really speaks to the culture here, the safety, the quality, the constant improvement that we're driving, and we're so proud of that. And I know you echo my sentiments.
It's a great thing because we sit together when we're working on this project on Leapfrog, and we see our improvements and we see our areas of opportunity, but it's truly maintaining that grade. You can always study hard for a test and do well on one test, but this is continuous monitoring, surveilling, making sure that our quality remains at the highest level day to day, month to month, and then marking period to marking period with Leapfrog. And it's a testament to, I believe, the work that gets done on the front lines.
Absolutely.
Because it's not, we collect and we analyze the data, but that's data that's being performed at the front line.
100%.
And if that front line wasn't able to perform at that level, the data would be reflective of that.
100%.
And the other thing that I find fascinating about Leapfrog is we're telling them how we're doing. So we're sharing, we're being very open. We're telling the public, hey, we're submitting this information because we believe we're doing well. And we want to share this information because we want to be evaluated to see sort of where do we stand from quality. Let's define quality. Let's make sure it's the same across, which is what Leapfrog is trying to do.
Yeah, and so I love that it's that letter grade because everybody can relate to that. And you see that green A, it just, it's a high quality organization.
And we celebrated, I think, the entire hospital just a couple of weeks ago.
We did.
With that announcement. So congratulations on that.
Yeah,
but tell us about some of these. So CMS, DPH, how do they evaluate how the hospital does from a quality perspective?
Yeah, it's all similar. So I mean, Medicare, it's a little bit more complicated as far as how they rank and score some of the metrics that get submitted. It's might require a little bit of a math degree, but they assign more like numbers, and then we take those numbers and can see where that number fits amongst all the other hospitals in the state or even in the nation. So again, it's all publicly reported. Any consumer can go on any of these government websites and type in St. Mary's and see.
Yeah.
Same with Leapfrog. It's all public information.
And that, I think, is where we're recognizing today we don't want to hide behind the fact that our doors are open, but what happens within our halls are going to stay within our halls. We want to keep it very transparent. We want to let the public know because they have choice.
Exactly.
They've got choice across the state of Connecticut where they want to get their care from, and I think that's important.
Yeah.
And we want to make sure that we continue to provide the care that's optimal and best suited for our patients overall.
Yeah, absolutely agreed. Yeah.
So as we wrap up, one of the things we ask everyone is that little pearl, that nugget from our provider, from our speaker, that they can share with the viewing population on something from quality.
Well, I've been at St. Mary's, like I said earlier, in several different roles for many years. And what keeps me here is the family atmosphere, the teamwork, the partnership, the collaboration, again, from the frontline staff all the way to our executive team. And the passion that every colleague has here for providing our patients with the highest quality, safest care is really what I want our community to know. It's what keeps me here. It's what would bring me here if I needed health care myself. And I'm so proud to be a part of the team.
Well, thank you very much,
Thank you.
and appreciate you taking a little bit of time out of your busy day to join us. I want to thank you all again for joining us and look forward to talking to you next time. Have a great day.